Hello everyone, I'm Millie Swan, a Vice President here at Forest Health, and joining me today I have Dr. Brian Batson, who's CEO with the Hattiesburg Clinic, and Dr. Steve Farrell, who is the Chief Medical Officer at Forest General. Thank you for joining us today. Well, as we kind of wrap up things here, we probably do need to give a little update on our numbers, because I know that's something that both of you are watching very closely, really hour by hour, those change. So Dr. Batson, can you just kind of give the community a little update on, the escalation that we've seen over the past few weeks and maybe at the clinic, the
Sure.
Hattiesburg Clinic?
The last few weeks have been extremely worrisome. This rise that we've seen in the positive cases has been exponential. So it's just not a gradual rise. It is rising very, very quickly. Last week, just in the Hattiesburg Clinic system, just in Hattiesburg Clinic, over 700 people were diagnosed with COVID. Over 700 in 1 week. That is higher than at any point during this pandemic. And we know that the higher number of cases there are, certainly more people will unfortunately need to be hospitalized. What we also know is of those 700 plus people that were diagnosed with COVID last week, over 88% of them were unvaccinated. So the vaccines continue to work very, very well. Those numbers of positive cases are extremely concerning, and the pace at which those numbers are rising is very, very frightening. We just in the first 3 days of this week, there were another 350. So certainly we anticipate that our number this week may exceed 750, which is very, very frightening. The only other thing I'll add to that is you can imagine that when we are performing this many tests now, our supplies are starting to be stretched, outpace the demand. With doing 2,500 tests in a week, we are struggling right now to keep up with the demand. Certainly we want everyone to be tested who needs to be tested, absolutely. And there are multiple places for patients to get tested, including many Forest Health facilities, cough and fever clinic, curbside testing, and the Department of Health opened up testing this week. We'll also be returning to C.E. Roy this Saturday. We are testing there on Wednesdays and Saturdays from 8 a.m. to 12 noon.
Yes, very important to know where they can have access, and I've heard a lot of people talking about the long lines and the concern, to your point, of getting the test done. What about, have you seen an increase in people coming in to get vaccinated?
We have a significant increase, in fact, over the last 2 weeks. You may recall we announced the Vaccine Appreciation Program about a month ago, and we saw a slight uptick then. But over the last 2 weeks, we've seen an even greater uptick in the number of people becoming vaccinated, which is great. It is never too late to become vaccinated.
Dr. Farrell, can you give us an update on the hospital side, just as Dr. Batson just did, as far as the clinic numbers, because, that's something, of course, we're watching hour by hour, minute by minute. Can you give us an update of what we've seen over the past couple of weeks?
Sure, Millie. Like Dr. Batson said, in the outpatient setting, what they see out there is just a foreboding of what we're going to see in here, which is even more worrisome. We've seen an exponential or even a meteoric rise in the number of patients who are coming to the emergency department with symptoms, being ill enough to have to be admitted to the hospital. Our inpatient hospital numbers now are almost as high as they ever have been in the entire pandemic. We keep around 80 to 90 patients a day in our hospital. About a third of those, or a little less than a third of those, are in our intensive care unit. It consumes about half of our intensive care beds. And we are not seeing that number decrease whatsoever. The alarming part of that is we've always talking about how the COVID illness affects people. What we haven't really addressed is how the COVID illness, the need for treatment of people with the COVID illness, affects the healthcare community. Because one of our biggest problems we have is as our beds and our resources get consumed at the hospital, managing COVID patients, we aren't available to take care of the patient in a car wreck, with a stroke, with a heart attack, the things that we're here for day to day to help people get over their illnesses and get over their injuries. Our ability to do so is being dramatically reduced because of the intensity of this wave of COVID illness. So anything we can do to reduce that number of patients is beneficial, principally vaccination.
And I know, just like for me, when I hear 80s and 90s, and to think that a couple months ago we were averaging around 4 a lot
That's
of
correct.
days, that is incredible. It is frightening, as you say. It really is scary. Well, is there advice as we kind of come to a close? A lot of people still are saying, well, if I'm vaccinated, not vaccinated, do I need to wear a mask again when I'm out and about? You know, what about indoors versus outdoors? Any advice that you all can give?
Go ahead.
Yeah, I'm a very firm believer as a vaccinated individual that if I'm going to be in a group of people indoors, I'm going to wear a mask. I don't wear a mask outside, walking the neighborhood, walking the dog, playing outside. I think that wearing a mask is another way to prolong our protection, and doing so voluntarily helps us achieve that without having to have mask mandates.
I agree. I think it can be frustrating sometimes. You know, we hear the CDC keeps changing their guidelines. Well, the reason those guidelines continue to change is because the virus continues to change, and our situation continues to change, and bed availability, positive cases, and how rapidly things are spreading. So the CDC continues to update their website, and we try to follow those guidelines as quickly as we know them. I agree with Dr. Farrell. As a vaccinated individual in an indoor setting, especially in a crowded indoor setting, I will definitely be wearing a mask for the foreseeable future until we see things improve again. We're in a desperate situation right now in the hospital setting, and we need to bide some time. Even for vaccinated people, thank you for those who did get vaccinated first, but we need to bide some time so that we can open up those beds again. And the best way to do that is getting vaccinated, and vaccinated or not, wearing a mask, especially in indoor settings.
Well, I really appreciate your time today. I know that you both are very, very busy, especially right now, but we do hope that we've been able to clear up some things, maybe debunk some myths that are out there, and provide more education. It's what we always want to do, and have open communication with the public. So thank you so much, and we'll just say that we hope everyone out there will consider being vaccinated. We know it's a sensitive subject, but consider it, and then please stay safe.